Welcome to the WebStation for Physicians training video. In this, we will learn about meaningful use, WebStation for Physicians or WSP, and computerized physician order entry or CPOE. In order to access WebStation for Physicians, click on the WebStation for Physicians icon on the desktop. There, you will put in your username and password that you use to log into the Windows system. Be sure that the environment says Paragon Live. When you are done with this, click Sign In and it will take you to your census screen. Once you are on your census screen, you may or may not have patients that show up under the encounters. If you have your patients show up under your encounters, they will already be up in your work list at the top. If your patients do not show up, you can find them by clicking on My Personal List and changing that to Open Access. You can also change the type to Current Patients. Use any of the search parameters such as last name, first name, and medical record number in order to find the patient that you are looking for. Once you have found them, two things you must be very careful about. You may have a large amount of patients in the system. It will make it very difficult to find them. If it is a common name or common information that you are using, be sure to use specific search parameters. If you have several patients in here, be careful not to hit build work list. This will put all of the patients that are in this list below into your work list. If you wish to just add a single patient, click the checkbox next to the patient name and click Add to Work List. Once you have done this, a dialog box may appear asking who you are in relation to the patient. Choose the most appropriate answer and the patient will appear up in your work list. From here, you will see several bits of information about the patient. The first one is going to be the allergies. If there is a red stop sign, that means the patient does have allergies. If there is a green box with a white check mark, that means that the patient has no known allergies. If there is a yellow box with a black question mark, that means no allergy information has been input. If this is the case, you will not be able to place any medication orders on a patient. To see the allergies, click on the Allergies tab and it will show you what the allergies are. If you wish to edit the allergies or add your own, you can do so by going under Edit Allergies and clicking on Add. To close that screen, just click on the Allergies button again. Next to that, you will see Code Status. If you hover over it, it will give you the code status of the patient. This is not edited by the physician, but instead is taken care of by nursing and registration. Next to that, you may or may not see a No Diet button. If this shows up, that means there is no diet order on the patient. If you click on it, it will take you directly into CPOE under Diets to order a diet. However, if you choose not to, this will not keep you from being able to place any other types of orders. On that same toolbar, on the far right, you'll see a person with a green shirt. If you hover over it, it will tell you who is logged into that computer. Two over from that, you will see display settings. If you wish to change any of the display settings on the toolbars below, you can do so by clicking on display settings. Just be careful. If you click on it, it will take away everything that's in these toolbars and you have to add everything back in. The buttons next to that, or the symbol next to that, are two arrows going around in a circle, or the refresh button. If you're waiting for any orders or lab results to come over and they haven't come, you can click the refresh button to help refresh the screen to see if they will process faster. The button next to that is Display Help. If this will show you information about this system and how it works. It gives you a lot of information about what works in the system and what you can do. Next to that, you'll see a small lock. This lock will actually secure the application down, preventing anybody else from getting into the med reconciliation or being able to place orders. It is very important that you be very careful about this lock. We usually recommend not to use it because if you walk away and you use this lock, you have officially locked the medrec out for any other physician and the pharmacy. Next to that is a sign out. Please do not use the X at the top for Internet Explorer. Please use this black square with the white X. This square will save the orders that you put through and it'll also prompt you if you have any orders that were unsubmitted that you need to submit and send off to the nurse. Also, another point is don't use the forward and back buttons on the Internet Explorer icons. Use only the WebStation for Physician area to navigate through the system. On the next toolbar, you will see your patient drop-down on work list. If you have multiple patients, you can drop the work list down and choose the patients underneath. The arrows next to that will allow you to cycle through the patients one by one. However, this does take time, and it's probably better if you use the drop-down to go through your patients. Next to the arrows, you'll see bits of information on the patient, including height and weight, creatinine clearance, body surface area, their location, age and gender, their admitting diagnosis, and several other bits of information. If you go all the way to the right, you might see a small black arrow. If you click on that black arrow, it will give you even more information on the patient, including the medical record number. On the next bar, you will see Problem and Procedures tab. It is a very important part of our meaningful use that you use this Problem and Procedures tab. Every patient that comes in the facility, when you work as a care provider with them, you must put in a problem or procedure or diagnosis under this tab. In order to access this, click on the problem and procedure and click on the problem list. Once you click on problem list, you will see two different lists. You will see the full list on the left-hand side, which is chronic, visits the patient from visit to visit. On the right-hand side is the current list. This is the meaningful use part. You must put in a problem or diagnosis on every patient that comes in. This particular list can only be changed, edited, or created by a PA, a nurse practitioner, or the physician. There are two ways to add information in for this patient. The first way is to pull it from the nursing patient profile under patient reported problems. How you do this, the very bottom of the center of the screen, you'll see historical sources. If you click on historical sources, you'll be prompted with another drop-down. On the drop-down, change it to patient reported. There you will see anything that the nurse has put in on the patient that you can put into the problem and procedure list. Click the checkbox next to the problem or procedure and choose whether to add to full, which is the chronic list, current, which is the current list being treated, or add to both. If you add to just one of them, you can move it over to the other side by highlighting the problem and moving it over to the right or left using the arrows in the middle. If you wish to add your own problem, click on the Add button and it will give you a search string. Use the search string to type in any orders and hit Enter or Go for them to come up. Highlight the most appropriate one and click Continue. This is going to ask you for a few other bits of information. Under the type, it is important to choose the proper type, whether it's a diagnosis, problem, or procedure. The date, you can put in month, day, year, month and year, just the year, or you can type in U for unknown. You may also put in a treating provider if you wish. The date, however, must be placed on all of them. Again, you will have the option to add to full, add to current, or add to full and current down at the bottom of the screen. Once you have clicked the appropriate answer and you have finished the list and everything that you needed in it, on the bottom left of the screen you will see a Save button. This will add the problems into the problem list. Next to the problem and procedure list, you will see Home Meds. If you click on Home Meds, you'll be able to take a look at any of the home meds the patient is taking or currently taken. If you wish to edit them or add your own in, click on Edit Home Meds and that'll take you into an Add and Edit screen in order to add them in yourself. Next to the Home Meds, you will see Advanced Directive. The Advanced Directive cannot be edited by the physician, instead is taken care of by the nurse or registration. But here you will be able to see the type of Advanced Directive, whether or not there is documentation in place, and when it became effective. The demographics screen will give you information on the patient, including their preferred language and any communication barriers. The implant screen will give you information on any implants on the patient. The newborn screen will give you information on any baby born within the facility, including length and weight. The blood screen will give you information on the patient's blood type and last blood transfusion. Immunization will give you an immunization record. If an immunization is given within the facility, it'll automatically update within this system. Patient Alert will give you alerts on the patient, including history of C. diff and MRSA. Pain tab will give you a pain scale of 0 through 10 color-coded. If you hover over the large number that appears on the left side, it will tell you the location of the pain. The Visit tab gives you current visit information on the patient, including isolation information. The Financial tab will give you financial information, including the primary insurance. Contacts will give you any contact information for a mother, brother, sister, daughter, or whomever needs to be contacted for the patient. Social history is part of the meaningful use that is handled by registration. It gives basic information such as age and social and smoking history. The Vitals tab will give you vital signs within the last 72 hours. If you wish to enter vital signs in yourself, you can do so by clicking on Edit Vitals. There is another Vital Signs tab that we will go over a little bit later. The Alcohol, Tobacco, and Recreational Drug tab will give you history and current information on any alcohol, tobacco, recreational drugs this patient has taken or takes. The Family History tab will give you information on the family history of the patient, including who they are in relation to the patient, the birth date of them, and the age and whether or not they're deceased. If you wish to see the actual cause of death or the problem that the family member has, click on the Edit Family History button and you can see the onset age and health problems in the middle. When you are done out of that screen, you can hit Save or Cancel. If you wish to add your own family history in, you can do so by clicking on the Add button. If you are done with family history, you can close that box by clicking the Family History screen. Next to the original census screen, you will see Action List. By clicking on Action List, you'll be able to see if there was any telephone, verbal, or protocol orders that were placed under your name. Here, you will be able to sign off on those orders and look at them individually. You will also see if there's any request for you to finish a med reconciliation. It is important that this list is checked regularly. It will get very large very quickly. The next tab we're going to go over is going to be the Deficiencies tab. This tab will launch you into the Horizon Patient Folder, or HPF. In this tab, you will have the option to sign off on any of your dictations. The Assignments tab we are not using within this facility. The Orders tab will give you orders information on the patient. You can choose the time frame and what type of order if you choose. This will only do non-pharmacy orders and diet orders. If you wish to see medications, 3 tabs over you will see the Meds tab. Under this tab, you again can choose how long ago you wish to see it, up to 1 year, and any medication the patient's on. This you can display active or inactive orders by checking or unchecking the active orders checkbox. Next to the Orders tab, you will see the Results tab. Under the Results tab, you can get laboratory, radiology reports that are finalized, rad image information, cardiology, and pulmonary function tests. You can again choose a time frame for any of these results. For laboratory, if you wish to see the lab results, you would just click on the description of the lab. If you wish to have multiple labs of the same type trended out, you can click a checkbox next to the lab and click the trend button. This will trend all of the labs side by side. Under the Radiology tab, this will show you finalized radiology reports. You may click on the description and view the report. Under the Rad Images tab, this will give you rad image information. It will also give you the option to launch into the PAC system. One thing to note, that launching into the PAC system from the screen will kick you out of the WebStation for Physicians. It is best if you use the PAC system located on the desktop by minimizing the screen and double-clicking the Synapse icon. The cardiology and pulmonary function test results will only come over after the patient has been discharged and that information has been scanned into the system. The Med Rec View tab will give you any information on the medical records on the patient that are in the Horizon Patient folder, including past dictations and results. The Vitals tab will give you vitals information on the patient. You can go back all the way to 1 year on the patient. Under here as well, you can trend out or graph out the blood pressure, pulse, temperature, or respiratory rate on the patient by clicking the BPPTR graph. You will also see measurements, which will allow you to see any nurse titrated meds and intake and output once the nurse has entered him into her system. The next tab you'll see Clinical Assessments. The Clinical Assessments tab will allow you to look at any clinical assessments done by the nurse. These include admission, daily, and post and pre-procedural assessments. One thing to note as well, if this significant box is checked, you will only be able to see any assessments deemed significant by the system. If you uncheck the box, you will be able to look at any of the assessments the nurse has available. The Patient Schedule tab will give you scheduled information for the patient, such as surgeries, endoscopy, and special procedures. It will, however, not show you if the patient is scheduled to go down to normal CT or radiology exams, X-ray exams. The Reports tab will give report information on the patient, including patient profile, which gives you a wealth of information that includes these toolbars right here at the top. The Caregiver Schedule will show you scheduled events or procedures that you are scheduled for if you are a surgeon or you do a procedure that requires scheduling. The Covering tab will allow you to choose a physician to cover for you. It is very important that you remember that you cannot choose yourself to cover for another physician. That other physician must choose to cover for you. If you wish to add a physician's name in, you can search for them by clicking on last name, first name, or caregiver ID and typing that in. Once you have that typed in, they will show up under the caregiver. Click the checkbox next to their name and add them to covering. Once you have added them to covering, go all the way to the right hand side under the bar of their name and click on the edit. This will allow you to put in a start date, start time, end date, and end time. You must do this, otherwise your patients will not show up under their covering schedule. When you are finished, click update and they will display the start date and time within the boxes. The last tab is the URL. The URL tab allows you to put in website information such as professional websites to be able to access easily while you're in WebStation for Physicians. The last tab we will go over is CPOE, or Computerized Physician Order Entry. When you click on the CPOE tab, you will see 4 other tabs appear on the screen. Order Queue is the tab where you will see all of your orders that display or any of the orders have been ordered in the past. It will give you an order status of active or inactive, several different processing statuses, including unsubmitted or add pending, which we will go over, the description of the orders, frequency, start date and time, stop date and time, and who ordered it. Underneath that order queue button, you will also see several other small buttons. The first button, Submit, will allow you to submit orders that have been saved that have not been sent over to the nurse yet. You click on the button, click the checkbox for the button, and click Submit. The Hold button will place any orders that you want on hold, either indefinitely or by you putting in a start date and an end date. Discontinue will discontinue any orders that are active or already in the system. The Cancel Request button will cancel any orders that have not made it to the nurse or have not been processed by the nurse. Resume will allow you to resume orders that have been placed on hold. Renew will allow you to renew inactive orders. And Reorder will allow you to reorder active or inactive orders. RX relationships will allow you to build relationships for medications such as take this with this, take this, or take this, then this, then this. The RX alerts give you any alerts from you or any of the other physicians, such as allergy and medication alerts. Cosign we are currently not using in this facility, and Clipboard will allow you to save orders on a desktop clipboard. In order to search for an order, click on the search button and this will give you 2 boxes. The box on the far right is a category box. In order to isolate information, you can use the category box to help define your search better. If you want to search, type in the search box what you are looking for. Couple things to note. For Dilaudid, morphine, and Zofran, please use the PF and not the other search parameters in order to find your medication. The PF are the ones that are used by the nurses regularly. The other ones are in large dosages. Once you find the route of the medication that you wish to use, click on the route and choose the medication type or the amount and frequency. If you do not see it in there, Two things. If the patient is a minor, you can choose to ignore age-specific dosing options. If you still do not find it in there, uncheck the Common Orders Only button and you will see several more orders come across. This is a scroll down for multiple orders, and it also has pages. If you still do not find what you are looking for, you can click on the order itself and choose to edit the full order. From here, you can make any changes that you wish and then click Submit. This will send the order directly over to the nurse and pharmacy. With the medications, you will see medication alerts come up before it submits the order. Read through them carefully. Anything in black, you do not need to put an override reason. If this shows up in red, it requires an override reason for doing it. When you are done, click Acknowledge Alerts. If you wish to put any other types of orders, you can then choose a different category and pick a different order. For orders such as radiology and laboratory blood cultures, some of them will require more information from you than the standard orders. If you look at the red asterisks, anything with a red asterisk will require your attention. For blood cultures, it might require a site to pull the culture. For radiology exams, it may require to put in pregnancy information on childbearing females, prep information if there is a prep needed, and then for all radiology exams, you need to place a reason or indication, either using the drop down here or texting it in. Drop down is preferred to use. Once you are done, you can submit or save. If you happen to have saved an order that you put through, you will see it under the processing status as unsubmitted. This means the order has not gone through the system. If you click on the Submit button, it will give you the dialog box. You check the appropriate box and click Submit. Once it's in an Add Pending status, that means it has gone over to the nurse and they can process the order. You can also add orders into your favorites if you use them regularly. To add an order into your favorites, find the order, and on the right hand side of the screen you will see clear flags. If the flag is checked blue, that means it is in your favorite order. If you wish to add another one into your favorite order, check the clear flag and it will turn blue. Click on Favorite Orders and you will find those orders show up in your under that screen. You can make labels by going to Label Maintenance and adding new labels in. Once you have added new labels, you can use the little gray tag symbol and label them individually, such as labs, medications, and radiology orders. One of the most useful features within CPOE are the order sets. The order sets are the result of the CPOE team using physician and nurse experience along with Zincs, which is a physician best practice system. In order to use order sets, use the drop down and change it to order sets. There are several types of order sets, including admission, discharge, and transfer order sets, along with others. If you do an admission, transfer, or discharge order set, it will prompt you if you want to do the med reconciliation that's appropriate for that set. Again, you may also add the order sets into your favorite orders by clicking on the flag. Once you find your favorite order set, click on the one that you would like to use and it'll give you the dialog box if it's admission, transfer, or discharge. Choose yes in order to be able to do the admission, discharge, or transfer med reconciliation. Once you have done that, it will take you into your home medications. With the home medications, you can verify the home medications by going to the upper right hand corner of the screen and clicking the small V. Once you have done that, the medications have been verified. You can choose to edit the medications, or you can add more in by clicking the Add button at the top. Once you are finished, the bottom left of the screen, you will see a Save button. Click on the Save button, and this will take you into your admission orders. Once you are in the order set, you will see two columns. The column on the right hand side shows all the orders that are going over to the nurse and are usually the recommended orders for that particular order set. The column on the left hand side gives you the option to add or remove orders within the order set. You can scroll down and choose to add or remove by checking or unchecking any of the boxes on the left hand side. Anything that shows a bubble requires information or for you to deselect the entire group. Once you have gone through your entire order set, At the very bottom of all the admission orders, you will see VTE prophylaxis. It's important that you address the VTE prophylaxis by either choosing one or by unchecking the top group. If you uncheck the top group, it will give you a dialog box that asks for the reason why you are choosing not to do that particular type of VTE prophylaxis. Choose the most appropriate answer and click Accept. On the right-hand side, you will see all of your orders. If you are admitting or discharging a patient, you can click on the description of the order, and under the instructions, you can type in the admitting diagnosis and the admitting physician. For discharge, you can type in the discharge diagnosis and any other instructions such as follow-up care. Once you are done, click Save, and this will take you back to your order set. On the right-hand side of the screen, you'll again see all of your orders. You may notice there is a stop sign. If there is a stop sign next to an order, that means that order has more information that needs to be addressed. Click on the description of that order. It will take you in. Anything that has a red asterisk must be addressed. Some of it will already be filled out for you. Anything that is blank, please choose the most appropriate information and click Save. When you have done this, it will then again take you back to your order set. Any of these orders can be changed by clicking on the description of them. Once you are all done, click Submit, and this should take you to the med reconciliation. On the med reconciliation on the left-hand side, anything that has a plus sign are the orders that you just placed within the order set. Anything that has a picture of a house are home medications. One thing to note about home medications, it is important that if you decide that you want to discontinue the use within the hospital, you do not use the discontinue button, but instead the defer, so it gets deferred to the discharge med reconciliation. If you use the discontinue, it will discontinue it for the home as well. Please select each line and make sure you cover all of the medications before you're able to complete this. If you wish to add any more medications, you can click Add Order at the bottom of the right-hand side of the screen and add any more. If you wish to add a home medication for the patient to go home with, within the Discharge Med Reconciliation, you will see an Add Home Medication. Once you have answered all of the questions necessary for all of the medications, on the left-hand side of the screen you will see the Complete button. Choose the Complete button, and this will take you to any medication alerts. Medication alerts, if they show up in red, do require an override reason. It is also important that you read through all of the medication alerts and understand them. When you are done reading through them, click Acknowledge Alerts, and this will finish out the med reconciliation. You may also see your orders by clicking on Order Queue and seeing the orders that you put through on the order set. If you wish to do a med reconciliation by itself, click on Med Reconciliation and choose the most appropriate type of med reconciliation by clicking the green circle inside of each of the boxes. When you are all finished with WebStation for Physicians, please remember to use the black square with the white X. Again, this will prompt you if you have any unsubmitted orders that have not been saved and sent to the nurse. Once you have done this, it'll take you back to the logon screen and you can exit out of the system. Thank you for watching the WebStation for Physicians training video.